Welcome back to the program, Health Check, where we discuss various health issues affecting humanity at large. Today we're discussing hypertension, otherwise known as high blood pressure or simply BP. And with me in the studio today is Dr. Mangwiro and Dr. Makanza. Dr. Mangwiro, you were about to get into the meat of the matter. We were about to talk about the complications of hypertension. Would you like to shed more light on what are the complications of hypertension?
Yes, yeah. Otherwise, we wouldn't be worried about this hypertension if there were no consequences that are bad. I'll start with the common one, like that Mrs. Konja, our first patient we saw. She had what we call a stroke. People normally describe a stroke to warohwa nezvishiri, warohwa nechikwambo, and it. What a stroke is, it's damage to the brain. There's shortage of blood supply to the segment or section that does the job of moving that limb. Okay? So if you have a stroke on the left side, you may end up failing to move the right side, and you may end up failing to speak. Your speech goes away. So the most important thing is that the complication comes because our blood vessels have thickened and they've developed what we call atheromas. These may plaque off or they may just close as they grow due to too much cholesterol. Like I was saying, that people have become obese, they have too much fat in their blood vessels. So stroke is one of them. And a stroke is something permanent, okay? So also people can bleed into the brain because of the stroke. And this can lead to disability or inability, whichever. Then the next point is stroke can be followed, or we can have problems with the eyes. Our retina can be damaged because of severe hypertension. People get blindness because of severe hypertension or even any hypertension, okay?
Yeah.
Then I go on to the major organ that's damaged, the heart. You know, the heart is in trouble, you know. So all the medicines that we give are trying to relieve the heart from getting tired. Because when the heart gets tired or the heart has failed to function as it's supposed to be, this is when you find a person who walks a few meters, they get tired, they sit down. When they try to sleep at night, they have to sleep seated. They wake up because they are full of, they can't breathe properly. And these people might have swollen limbs, swollen abdomen, okay? Pachivanhu kadumbuka narazvimba namakumbo kuroiwa kawo. Asi ndiyo BP, that's hypertension. It's because the heart is no longer doing its job as it's supposed to do.
Okay.
Okay? So the heart has got far-reaching consequences. And on the heart, one can have a heart attack, which can lead to severe chest pain and damage the muscles of the heart to the extent that it can no longer function properly. The coronary arteries will have been damaged by the hypertension because of the atheromas I'm describing. So it's also another very bad event that can happen to a heart in a patient with a severe hypertension. So the heart is very important. I move next to the other organ that can be damaged, the kidneys. If the kidneys have bad blood supply because of hypertension, people will end up unable to clean or clear toxins from their bodies. And then we say they are now in chronic kidney disease or acute kidney disease. Once this happens, if it becomes chronic, people may end up failing to urinate at all. And they can end up on hemodialysis. Nowadays it's quite expensive. It may be needing 2-3 sessions a week because your kidneys have been damaged properly by the hypertension. So it's something that we need to worry very much about, because renal failure, we are not yet advanced enough to do kidney transplants in Zimbabwe We have no policy on on organ donations and all that. So it's done outside the country. Maybe those who can afford can do it. But kidneys are something that we need to watch out for very much in hypertension, whichever it is.
Okay. Thank you, Dr. Mangero, for giving us the crux of the matter. When it matters the most is the brain, the heart, the kidneys. Dr. Makanza, would you like to add more complications when it comes to the peripheries, the limbs, the lower limbs, and any other complications?
In addition to what Dr. Manguro has just mentioned, we can also have peripheral vascular disease, which is caused by the same mechanism of atherosclerosis, where these plaques occlude the lumen of the blood vessels that take blood to the peripheries. Eventually, patients with that disease, called peripheral vascular disease, can end up losing their limbs or getting chronic ulcers. Otherwise, he had mentioned the main complications of hypertension that we worry about.
Okay. As you've seen and we've heard, hypertension affects your body in its entirety. From the head, you can get a stroke, the eyes can get blind, the heart can get a heart attack, you can get kidney failure from the kidneys, and you can get peripheral vascular disease. You can even get amputated on your lower limbs if you don't get your hypertension managed very well. Thank you so much for discussing the complications of hypertension. Now I want to move further, or you want to add something, Dr. Mangero?
Yes, I wanted to tell something. Hypertension also affects sexuality very much.
Okay.
Most people end up with failing to have sex because hypertension affects that area very much. So we can move on. I had forgotten that one.
Okay, thank you so much. Yes, it's talking about a condition called erectile dysfunction. Hypertension is a common cause of erectile dysfunction, and you can imagine without sex, the house is almost dead. Now moving on to the management of hypertension. I want to discuss the medical management and talk about the drugs that are used in managing hypertension. Which drugs do you think are used commonly and popularly? You saw in that clip, Mrs. Konje had a lot of drugs that she was taking. In the meantime, before we go on to the management of hypertension, let's take a short break and come back for the third segment and discuss the management of hypertension.